We're talking about the positivity rate of COVID-19. It has been going up slowly but steadily over the past month because of the Delta variant. But it's making for some difficult conversations because we don't know what that's going to mean in terms of deaths and hospitalizations going forward. Are they going to start rising as well? They've only gone up a tiny amount so far, but there are some concerns.
And Fox 2's Keith McGilvery is digging further into this. He's live in East Hartford with more. He has the latest from our vaccine team. Keith, good morning.
Erica and Tim, good morning. And Tim and Erica, one of those difficult conversations also could have to do with parents deciding whether to vaccinate their children. Invited back Laurence Burnsed, the health department director here in East Hartford, to kind of talk about some of these issues. I appreciate your time here at 10 and want to just jump right into it. Parents right now, many of them making that decision as to whether they should vaccinate their kids. What say you?
It's definitely recommended. For anybody that's 12 years of age and older, it is recommended. And there's several reasons for that. One is we know that these are safe and effective vaccines that have been studied. There's a couple of misconceptions that might cause concern or hesitation. For example, one of the common questions we get is, were kids truly included in some of the studies early on? Well, if you recall, initially the vaccines like Pfizer were just approved for 16 years of age and older because they were in the first group that were in the clinical trials or studies. But then our researchers were conducting studies that included 12 to 15-year-olds. Once we saw the data come in, it was safe and effective, then they were added later in the time frame for vaccinations. So the data is there to support that it's safe and effective. Another common question that we get is the concern about altering your DNA. This is a vaccine that has the blueprint for your immune system to essentially prime itself to protect you if you were infected. It actually does not enter into the nucleus of your cells, which is where your DNA is stored. So it does not alter your DNA whatsoever.
I was going to say, you have talked specifically about the push to get young people vaccinated in this community and really across the state. Talk to me about a concern that I've heard from folks my age when it comes to fertility, folks looking to think about family planning and have reservations on that front.
Exactly. So another common question we get, especially when we're talking about young adults. And we know that there is no occurrence of causes of infertility among individuals that receive this vaccine. That was something that was evaluated during the early studies when these vaccines were still under investigation. And then data is constantly collected as people have received the vaccine. So millions of doses throughout the U.S. have been collected, and people have been still getting information collected through their doctor visits or self-reporting, and there's been no occurrences of infertility. And what we know is that this is, again, a vaccine that is specifically primed for providing a blueprint for your immune system. So it actually does not have any impact on your reproductive health or your reproductive system in general.
And if we go back to the kids for just a minute, families across Connecticut spent the last year either with their kids remote learning or in a classroom with a mask. There are conflicting viewpoints as to whether masks are a good idea, especially with this Delta variant and its infectiousness as we head into fall. Do you recommend students be wearing masks when school gets underway in just a couple of weeks?
So we recognize that our state public health partners are still going through the guidance, but what we know for sure is that the data tells us that essentially masks are beneficial. Beyond vaccination, masking has been one of the most important protective measures since the beginning of this pandemic. Once we understood and knew that even masking with cloth and fabric masks can protect not only yourself, but also those around you in case you were affected. So in general, what we're saying is that still, if you have not been vaccinated yet, in general, you are recommended, in the state of Connecticut, required to still wear a mask indoors around others. If you are vaccinated and you have underlying conditions that you're concerned might impact your immune response to the vaccine, you might still want to wear a mask when you're in close proximity to a large group of people just to be ultra protective of yourself. So yes, we would definitely really consider the masking part. We would likely see that, especially for younger kids that are not eligible yet, we'll likely see that masking is still going to be advised in the guidance because we know that it is a good, effective measure.
And to that last point there, I might ask you to kind of look into your crystal ball here. Kids 12 and under, when do you anticipate they may be able to get a shot?
So that's a timeline that's still kind of in a gray zone because that's our federal partners with FDA and CDC. They evaluate the information in science. They're reviewing the data right now. We might see later on this year or early next year, we'll see some eligibility for younger age groups.
Laurence, so appreciate your insight this morning. It was great to meet you again. Welcome to Connecticut. Do want to point out, I'm going to have our digital team post this segment up on fox61.com. If you're a parent, a teacher, want to share this with some other families in your community, we will do that. But for now, I'll send things back to you.